This presentation is focused on the clinical challenge of rehospitalization within the skilled and long-term care setting at Pleasant View Center. At the end of this presentation, you will have acquired knowledge on the common gaps in practice that influence rehospitalization, evidence-based practice that has shown successful reduction of hospitalizations, and specific strategies to reduce hospitalizations at Pleasant View Center. 15 to 25% of patients admitted to LTC facilities are rehospitalized within the first 30 days of admission. Rehospitalizations result in disruptions to the continuity of care, increased healthcare costs, emergency room burden, and can expose patients to increased risk of infection, falls, and delirium, especially in the elderly. Common influencers of rehospitalization include communication gaps, inadequate knowledge of staff, patients, and families, limitation of resources at the center level, and lack of early identification of condition changes. As a nurse, you play a vital role in avoiding unnecessary rehospitalizations, and with the proper knowledge and process, hospitalization rates can be reduced at Pleasant View Center. This presentation will focus on several strategies to tackle the clinical challenge of elevated rehospitalization rates that include enhanced education on common admitting diagnoses, early identification of changes of conditions, improved familiarization of resources available to the center, enhanced optimization of advanced care planning with patients and families, and streamlined communication among the clinical team. When a fall occurs in a rehab or nursing facility, it's important to quickly determine if the situation is urgent or an emergency. Emergency situations, such as head trauma, severe fractures, or spinal injuries, require immediate medical intervention and often hospitalization. However, urgent situations, like minor fractures or bruises, may be safely managed in-house, avoiding unnecessary hospital transfers. Note that many falls that occur at Pleasant View are without injury or involving minor injuries that can be managed in-house. Our fall assessment process is comprehensive. First, we perform a visual inspection for any visible injuries, looking for bruises, swelling, or deformities. We then assess vital signs to ensure the resident is stable. A thorough skin, musculoskeletal, and neurological assessment completed by the primary nurse follows, checking for issues like fractures, pain, or signs of head injury, such as confusion, dizziness, or abnormal neurological assessment. If the situation is urgent, we notify the AP or physician to assess the injury and determine if the resident can remain in-house or if they need further care. For more serious injuries, we also attempt to notify that in-house provider to assist with determination of escalation of care to the emergency room. With our in-house capabilities, including X-rays, lab tests, and access to orthopedic referrals, we can often avoid hospitalizations by treating residents here when possible. It is important to ensure that transfers to the hospital are appropriate and are true emergencies to avoid community burden on the hospitals, 911 transporters, and other transportation companies. Hospitalizations that occur involving non-emergent cases could reflect negatively on Pleasant View Center, straining community relationships and resources. Please utilize your advanced practice provider and nursing leadership for any questions about referring cases to the emergency room prior to transfer. Post-fall monitoring is critical. After the fall, we continue to observe the resident for any signs of deterioration, reassessing vital signs and ensuring they're comfortable. Finally, we adjust the resident's care plan based on the assessment, implementing additional fall prevention measures and involving the family in the process. This approach not only ensures immediate care but also helps prevent future falls and unnecessary hospitalizations. Research has identified 6 conditions responsible for about 80% of potentially avoidable hospitalizations among long-term care, LTC, residents: congestive heart failure, CHF, chronic obstructive pulmonary disease, COPD, pneumonia, urinary tract infections, UTIs, cellulitis, and dehydration. Congestive heart failure, CHF, accounts for 11.6% of hospitalizations in LTC residents. CHF is a condition where the heart fails to pump blood efficiently, causing fluid buildup in the lungs and other body parts. Key symptoms include shortness of breath, especially with exertion, swelling in the legs and feet, fatigue, rapid or irregular heartbeat, persistent cough, weight gain, confusion, and reduced appetite. If these symptoms worsen, it is critical for the nursing team to notify the advanced practice provider, (AP), for timely evaluation. Management includes diuretic therapy, cardiac medications, e.g. ACE inhibitors, beta blockers, low-sodium diet, supplemental oxygen, and possibly palliative care. Monitoring should include daily weights, as a weight gain of more than 2 to 3 pounds in 24 hours or 5 pounds in a week may indicate exacerbation. A multidisciplinary approach, involving medication management, lifestyle changes, and caregiver education, is essential for preventing exacerbations and improving outcomes in LTC settings. Chronic obstructive pulmonary disease, COPD, accounts for 6.5% of hospitalizations in LTC residents. COPD, a combination of chronic bronchitis and emphysema, leads to obstructed airflow in the lungs. Common symptoms include shortness of breath, persistent cough, wheezing, fatigue, thick sputum, frequent respiratory infections, and unintentional weight loss. Evaluation for exacerbations includes chest X-rays, lab tests, and clinical presentation. In-house management may involve bronchodilators, corticosteroids, oxygen therapy, antibiotics, and respiratory therapist evaluation. Non-pharmacological strategies include breathing techniques, e.g. pursed lip breathing, physical activity, and incentive spirometry. Routine monitoring of symptoms, lung function, and oxygen levels is essential for adjusting treatment plans and improving the quality of life for LTC residents with COPD. Both pharmacological and non-pharmacological treatments should be utilized to manage the disease effectively. Pneumonia is a major concern in long-term care settings, particularly among older adults with underlying health conditions, accounting for approximately 10% of hospitalizations. Pneumonia, an infection in the lungs, can lead to serious complications if not treated promptly. Early recognition and appropriate treatment are crucial. Common symptoms include fever and chills, dry or productive cough with discolored phlegm, shortness of breath, worsening with exertion or at rest, sharp chest pain, worsening with deep breathing, fatigue, confusion, tachypnea, rapid breathing, and cyanosis, blue-tinged skin or lips indicating hypoxia. Evaluation may include clinical presentation, chest X-rays, or laboratory tests. In long-term care, pneumonia is treated with antibiotics, either orally or intravenously. Oxygen supplementation may be necessary for patients with hypoxia, and fluid management helps set mucus and prevent dehydration. Pain relief and fever management may also be needed. Respiratory support such as nebulizer treatments or CPAP/BiPAP might be required. Close monitoring of vital signs, particularly oxygen levels, is essential to assess treatment response and detect deterioration. Nursing staff should closely observe for signs of sepsis or respiratory failure, which may include hypotension, tachycardia, hypoxia, fever, tachypnea, and altered mental status. Any abnormal findings should be reported urgently to the provider. Dehydration is another common issue in long-term care, responsible for about 10% of hospital admissions. Older adults are at higher risk due to decreased sensation of thirst, medications, and chronic illnesses. Symptoms of dehydration include dry mouth, increased thirst, decreased urinary output, fatigue, confusion, dizziness, dry skin, hypotension, tachycardia, and constipation. Evaluation typically involves clinical presentation and laboratory tests. Treatment includes fluid replacement, either orally or intravenously, with close monitoring of intake and output. Proactive management of fluid intake is crucial to prevent dehydration and ensure resident health at Pleasant View Center. Both pneumonia and dehydration require vigilant monitoring and prompt intervention to reduce the risk of complications and unnecessary hospitalizations. Urinary tract infections are common diagnosis in the long-term care facilities that can account for up to 14% of hospital admissions. An assessment within the urinary tract may present with common signs and symptoms of frequent urination, urinary urgency, dysuria or pain sensation felt during urination, cloudy or odorous urine, hematuria or blood in urine, confusion, fever or pelvic, back or abdominal pain. Evaluation of urinary tract infection may include clinical assessment, urinalysis with reflex to culture and sensitivity, as well as laboratory studies. Treatment approaches for in-house care include antibiotics, hydration, pain relief, monitoring for worsening or persistent symptoms, and preventative strategies to reduce risk of recurrent urinary tract infections. Preventive strategies may consist of hygiene, catheter care, timed toileting schedules, and incontinence care. Prompt recognition and treatment are essential to manage tract infections effectively and prevent hospitalizations in the long-term care setting. Cellulitis is the last of the 6 most common diagnoses, responsible for 5% of hospitalization among long-term care residents. Cellulitis is an infection of the skin and soft tissue that, if left untreated, could lead to sepsis. Common symptoms of cellulitis include redness, swelling, pain or tenderness, fever, blisters or skin lesions, chills, and malaise. Identification of a cellulitis infection is often made by clinical presentation. In-house treatment management includes antibiotics, either IV or oral, wound care, pain management, elevation to reduce swelling, monitoring of symptoms to evaluate for worsening or resolution, and preventative strategies such as proper hygiene and identification of early signs of infection. After reviewing the 6 most common diagnoses for hospital admissions from long-term care centers, we can now focus on in-house management to reduce unnecessary hospitalizations. It's estimated that about 45% of hospitalizations from long-term care centers could be avoided. This is because facilities like Pleasant View are equipped with resources to care for sick patients on site. By optimizing resources for stable patients, we help ensure that emergency rooms and 911 services are reserved for true emergencies, preventing unnecessary strain on these services. At Pleasant View Center, we have a range of resources available to evaluate changes in patient conditions. We have advanced practice providers from Align Med Partners on site from 7 a.m. to 5 p.m., 5 to 6 days a week. After hours, on weekends and holidays, support is available through Third Eye Health. The Concord Hospital phlebotomy team visits the center daily from Monday through Friday to complete scheduled blood draws, with stat blood draws handled by our in-house 4 certified nurses in collaboration with Concord Hospital's laboratory. Trident Care, our mobile radiology team, provides X-rays, ultrasounds, and EKGs at the center, eliminating the need for patients to leave. Palliative care consultations are also available on-site weekly. Additionally, we have in-house specialty support, including Access RN for difficult 4 placements and Trident Care for PICC line placement and verification. Pleasant View Center receives pharmacy services from Health Direct Pharmacy, which delivers medications multiple times a day, handles stat orders, and provides access to a stocked emergency medication kit. Our center also benefits from routine visits by a diverse medical team, including respiratory therapists, dental, audiology, podiatry, optometry, and dermatology specialists. For referral or contact information about these services, please speak with your nursing supervisor or leader. By leveraging these in-house resources, we can manage common diagnoses effectively and reduce unnecessary hospital transfers, ensuring optimal care for our residents. Early identification of changes in a patient's condition can help reduce hospitalizations, prevent further deterioration, and improve outcomes and quality of life. Early signs of a change in condition should be routinely monitored, including vital sign abnormalities, changes in mobility or balance, changes in weight, new or worsening pain, changes in cognition or behavior, and signs of dehydration. The clinical team is responsible for assessing patients for changes, with all team members taking responsibility for identifying changes and taking appropriate action. At PVC, vital signs are monitored every shift for skilled patients and at least once weekly for LTC residents. If a change in condition is noted, vital signs will be monitored every shift for 72 hours to allow for trending and close evaluation. It's essential to take note of vital signs that may be considered normal but vary from a patient's usual baseline. For example, if a patient's temperature typically runs at 97.0 degrees Fahrenheit but is currently 99.5 degrees Fahrenheit, the clinical team should recognize this variation and consider further assessment. A focused assessment targets specific body systems when a change of condition or new symptom is observed. This assessment gathers detailed information about a chief complaint to identify abnormalities. The findings should be communicated directly to the provider using the SBAR technique to coordinate a care plan. Next, the patient and their responsible party should be notified if they were not present during the discussion. This helps streamline communication, answer questions, and clarify the goals of care. For example, consider an 82-year-old female patient with a history of CHF and COPD, noted to be experiencing fatigue and rapid breathing during ADL care. The licensed nursing assistant reports the concern to the primary nurse, who performs a focused assessment. The nurse notes increased fatigue, a respiratory rate of 24, a 5-pound weight gain in 48 hours, crackles in the bilateral lung bases, and bilateral ankle swelling. The nurse communicates these findings to the covering provider using the SBAR technique. I am a nurse calling from PVC regarding an 82-year-old female patient with CHF and COPD. She is experiencing fatigue, tachypnea, weight gain, crackles in the lung bases, and ankle swelling. Her oxygen saturation is stable at 94% on 2 L of oxygen, but her respiratory rate is 24. These symptoms are new today, and I suspect fluid overload or worsening heart failure. Could you please evaluate her for escalation of in-house management? Early detection of changes in condition can lead to improved patient outcomes. As part of the clinical team, it's essential to act quickly on identified changes to prevent complications. Use the tools available at Pleasant View Center in collaboration with assessments to monitor changes. Your observations could be key in addressing a change of condition and potentially avoiding hospitalization or further deterioration. It is urgent that nursing follow a detailed process after a change of condition as identified. Acquiring a current set of vital signs in a complete focus assessment is crucial, and the assistance of correct diagnosis of the patient's condition. Nursing should act within their scope of practice and with autonomy to implement urgent nursing interventions such as ensuring a safe environment, patient positioning, prevention strategies to avoid deterioration, risk assessments, use of assistive devices, oxygen application, and administration of already ordered medications to prevent negative patient outcomes. Advanced practice providers should be notified about a change of condition in a timely manner. This allows for a plan of care to be developed and further patient deterioration to be minimized. Reports should be given the advanced practice provider in the form of an SBAR including description of the situation of the change, patient's background, assessment completed and recommendation for action. The nurse plays a crucial role in managing changes of condition at the facility. It is the duty of the nurse to advocate for the patient, encourage adequate use of in-house resources, and avoid unnecessary hospitalizations. The nurse will collaborate with the advanced practice provider to develop a plan of care that addresses the patient's clinical concern and is in line with the patient's goals of care. The nurse will communicate any care preferences that have been previously set by the patient that may include direction for do not resuscitate, do not intubate, do not transfer, comfort-focused care, no intravenous medications or fluids, or no diagnostic studies. This communication between the nurse and the advanced practice provider is essential to ensure that the patient's wishes are followed. After a plan of care is developed, the nurse will ensure the patient and/or responsible party are aware and consenting to the plan of care. The nurse will continue to monitor the plan and its outcomes on the patient's clinical change. The nurse will continue to timely communicate any further changes, deterioration, or progression to the advanced practice provider. The nurse plays the primary role in identifying and responding to clinical condition changes to ensure timely intervention that can prevent patient complications and improve outcomes. Setting goals and confirming advanced care planning are essential to avoiding unnecessary hospitalizations. Advanced care planning and goal clarification is more than just defining a code status. Advanced care planning involves discussing and documenting a patient's preferences for future medical care, including treatment goals and decisions. Advanced care planning is essential to ensure that a patient's wishes are respected and allows for guidance with their healthcare. Upon admission to Pleasant View Center, goals of care included code status are addressed and documented by the admitting nurse team. Further conversation regarding advanced directives, treatment goals, and plan of care are conducted by the advanced practice provider and social services. Setting goals and confirming advanced care planning are essential to avoiding unnecessary hospitalizations. Advanced care planning and goal clarification is more than just defining a code status. Advanced care planning involves discussing and documenting a patient's preferences for future medical care, including treatment goals and decisions. Advanced care planning is essential to ensure that a patient's wishes are respected and allows for guidance with their healthcare. Upon admission to Pleasant View Center, goals of care included code status are addressed and documented by the admitting nurse team. Further conversation regarding advanced directives, treatment goals, and plan of care are conducted by the advanced practice provider and social services. Now that you are educated about the high level of care that can be delivered at Pleasant View Center, you are equipped with the tools to educate families and enhance patient outcomes by avoiding unnecessary hospitalizations. Your knowledge and expertise on resources may also need to be shared with covering on-call providers, as they may not be familiar with the resources at Pleasant View Center and lean towards hospitalization for patients with acute changes. Advocating for your patients includes offering insight to available resources at the center to streamline interdisciplinary care. Advanced care planning and goal clarification is a continued process that requires ongoing confirmation and adjustment. Prior to any hospitalization, goals should be clarified by the nurse to ensure hospitalization is the preference of the patient while also clinically indicated. An estimated 45% of hospitalizations from long-term care facilities could have been avoided. We have identified the two biggest components that lead to rehospitalizations as insufficient knowledge and communication. We have identified frequent changes in condition and the importance of early identification to optimize outcomes. The 6 most common admitting diagnoses have been reviewed and in-house treatment plans have been discussed. The significance of communication with patients, families, responsible parties, and the nursing team has been promoted, and the importance of advanced care planning and goal clarification has been presented. With this knowledge, improved communication, and resources available at Pleasant View Center, unnecessary hospitalizations can be reduced. Thank you for your time viewing this presentation and your support with improving the rehospitalization rate at the facility. Your commitment is essential to Pleasant View Center's success.